questions around those before? I'm sorry, I haven't really read that. Okay. So then, who is the intended user of this, and what do we really want people to do with this? The intended use is really that this blueprint can be cited and utilized by advocates and decision makers to healthcare reform, health systems, to increase health equity for our communities. So it's really creating a document that's framing health equity for the Asian American and Pacific Islander community that we can take forward and promote change with. The intended users, really, I know you can't have a general, just everybody is the intended user, but almost everybody really is. It's those that are committed to a healthy Minnesota and committed to health equity, really, in the end. So if you really believe that the healthcare system is broken, which I think most people do, what I would encourage is for you to take this document, take a look at it, and think about what you can do to fix the system for our communities. So, and hopefully nobody will be alone. We'll do this together. But finally, our next steps. Our next steps are to measure and monitor AAPI health equity here in Minnesota. And so to do that, we are developing indicators for each of the recommendations within this blueprint. And then we are looking to produce a baseline report in 2011. And then second in our next steps is we really want to disseminate this blueprint widely. We made 1,000 copies, so please take as many copies as you want. And we're going to continue disseminating this because we want decision makers to healthcare reform, and health systems to know about this, to be able to take a look at this and reflect on how their healthcare is provided and what they can do to better meet our needs. But then also we want to disseminate it across diverse communities. So we want to disseminate it across our Asian American Pacific Islander community, but we also want to disseminate it to our allied immigrant, refugee, LAP, high priority population.
I just want to introduce the highlights our community health worker, and CAPI is just a little bit about the background and the map. We don't even, our name was more like Central and Asian, but we serve like multi-ethnic group. So our biggest population is Southeast Asian and East African. So going back, I think Nancy gave a great information on the blueprint and the process involved, and I know Jennifer is here. She can tell more about the process we worked the entire year. But it was a very thorough process, and it was a lot of intense work because just bringing all the key stakeholders and talking about the key community health issues, it was challenging because we were talking about various health issues, and at the we came to a common point like it's the same health issues we all are facing in our clients, and we serve like 3,000 refugees, immigrants throughout the year, and it's not just CAPI and our clients, it's the same, it's all over the community. So that was one of the key things. The advisory committee that came together with different health issues and where we want to focus the core teams, but also what each organization is doing within their own community, and what are they doing with the data collection. And we are collecting, but what happens, where does the data go? And that was another thing that we talked about in our advisory committee, that how it reflects and how it's used, and what are the main issues that affecting the community. So that was I think we heard from each of us. There were the core teams, and that it's in the blueprint, but it was very intense, and we all had the same voice that we had to be part of the decision making and how it affects the health system in general. So I think this blueprint is going to be very effective in our work too, because we do health and in various different ways, but it's going to help moving forward in our work. So I don't know if Jennifer wants to add something.
Oh, I would just agree with what you were saying too, and Nancy did a really nice job outlining the work. But it was an intense process to get through. And I remember when we first started out, we had across that whole wall so many different issues, and then we narrowed it down to these 4. And so that whole process just, it did for me. It highlighted what do we have in common, because where I work now and where we serve, it's not only APIs, it's significant Latino, but there's similar issues in terms of accessing services, having LAP services, and also East African where I'm at. So, you know, but it was definitely really a synergistic experience, you know, to work with the other groups to come together and to see commonly what are our barriers that we're dealing with. So, and this will be very useful. I know for our work at Westside, where I'm at, to bring this back so that it can help inform some of the work that's happening there, and hopefully strategically be used in how we serve better the community. So.
Yeah, I think the other piece was, this is like it's the API, the health data, but I think the stakeholders were from all different backgrounds and serving all different kind of clients. So it is the story from, you know, not just from, you know, Southeast Asian. It's, I think the group was a very diverse group. So it was very helpful to know that we have the same cultural, you know, norms and related to health. So that was very key, that understanding from each other.
Can I say something really fast? Yeah, and a few months ago, MAAC was invited as part of several community members who are engaged in health equity work from different communities. We were invited as sort of the API sort of authority to speak about, they convened a meeting of MDH departments, so there were some folks from cancer work, people who are doing diabetes, that sort of thing, at MAAC, or at MDH, and they wanted to hear some of the issues that we were addressing that pertain to social determinants of health. And although, you know, we didn't talk about it here, a lot of the issues that are highlighted in the blueprint are relevant to conversation of social determinants of health. And so I talked a little bit about that, and they were definitely interested in seeing our blueprint, and I think of that as a really good, you know, Nancy talked about dissemination and trying to influence processes. That would be a really good way to do that, you know. Sit all the health department folks and see how, you know, all their different divisions are adequately or inadequately addressing API health issues.
And I just wanted to add one thing that this is, I know not everybody's name is listed here because, you know, it's a small, it takes a lot of pages. But I think most of the stories which I brought it here and we had the data, it was from my, you know, from Saharla and from other staff, which they share with us. So it was not just what we hear, it is what's happening in the community. So that was very interesting that this is all that is from, you know, people who are doing the actual work, so in the community. So that was very key.
Thank you. Bruce, do you have anything?
Well, I had a very small part in this, but it's a very interesting project. I was just making notes of some places for dissemination, because I think that is really important. This shows a consensus on a lot of issues that are of interest to the Asian Pacific Islander community, and there are a lot of people that need to know about it. So I'm thinking of the Center for Urban and Regional Affairs at the university, which is connected with the
I'm from Curative.
Okay. Yeah, and they, you know, they fund projects that involve community action. Medical school, especially Department of Education within the medical school. There's a University Community Involvement Center, I don't know the name exactly. Asian American Studies at the university. Metro Area Refugee Task Force that meets every month with the Department of Health, and that would be a good forum for presenting this so that everybody would be aware of it. And then, you know, other organizations, I don't know if there are any CARN here, but I was at an event and the CARN organization in St. Paul recently. It's a very strong new organization, and I'm sure that they would be a partner.